time you respected a patient's dignity and privacy? The answer to this question is, on one occasion, a patient became very upset when staff started discussing their care in front of others. I recognized that this compromised their dignity. I calmly moved the conversation into a private area, reassured the patient, and reminded colleagues about confidentiality. The patient felt respected, and the team reflected on how important it is to maintain dignity in all situations. That's a very good answer. You might feel as if these answers are short, but they just need you to go straight to the point. So sometimes we don't want to hear long stories, because sometimes these interviews, we really book them for about 30 minutes. So we're just trying to ensure that we get the essence of how best you will interact with the patient during the situation. The fourth question asked during an interview for a Band 5 mental health nurse is, how have you balanced safety and respecting a patient's autonomy? While on placement, a patient questioned on escorted leave. While on placement, a patient requested unescorted leave, but their risk assessment showed concerns about self-harm. My role was to balance safety and independence. I explained the reasons for temporary restrictions and worked with them to agree a gradual plan, starting with a supervised leave. This meant their safety was maintained, but also they felt included in the decision-making, which built trust between myself and the patients. This was straight to the point, removing all the fluff from there and giving you an idea of how best to answer this kind of question. The fifth question asked during an interview for a Band 5 is, describe the time you advocated for a patient's wishes. So the answer to this question is, a patient once told me they were experiencing unpleasant side effects from their medication, but they felt they weren't being taken seriously. I listened, validated their experience, and documented their concerns. I raised this at handover and encouraged them to share this directly with the doctor, offering to be present in the room if they wished. As a result of this, their medication was reviewed and adjusted. The patient felt more involved and respected in the treatment. A sixth question asked is, how would you involve families and carers in patient-centered care? So the answer to this question in most cases is, or a sample answer I would say to this kind of question is, I would involve families and carers with patients' consents, as they can provide valuable insight into the person's history and needs. For example, during discharge planning, I would ensure carers are included in discussions so they can support the patients at home, while keeping the patient's preferences central to the process. So this is a very good one of ensuring that the patients and carers are involved in the patient's care, and it's also a patient-centered care kind of question. The seventh question is, give an example of supporting a patient's recovery journey. So the sample answer to this question is, while supporting a patient with depression, I noticed the struggle to engage in group activities. I wanted to encourage them without causing pressure. I built rapport fast and asked them about their interest. I suggested starting with short talks as an alternative. Gradually, I encouraged them to attend a group session. Over time, their confidence grew and they began engaging more regularly, which supported their recovery. The eighth question for a Band 5 on patient-centered care is, how would you ensure care remains patient-centered during a busy and stressful shift? How you would answer this question is, on a shift when the ward was short-staffed, several patients needed support at the same time. My task was to ensure patients felt cared for, not just processed. I communicated clearly with patients, explained any delays, and prioritized accordingly to need. I made sure even brief interactions included compassion and reassurance, and I updated patients regularly. Patients felt acknowledged and supported, and the ward remained calm despite the pressure. This is another good example of patient-centered care. The ninth question that would mostly come up for a patient-centered care question for a Band 5 mental health nurse is, can you tell us how you apply the principle of the NMC code in promoting patient-centered care? So the sample answer for this question is, during placement, I worked with a patient who was anxious about medication changes. My role was to uphold the code by prioritizing people, practicing effectively, and preserving safety. I listened to the concern, provided clear explanations, and ensured the nurse in charge was aware. I maintained accurate documentation and ensured the patient's preferences were considered. The result was the patient reported feeling more confident in the decision, and care was both safe and person-centered. That is an amazing answer for you to be able to say during your interview. A 10th question is, what does dignity and respect look like in a day-to-day nursing practice? So a good answer on STAR principle is, I supported a patient who needed assistance with personal care but felt embarrassed asking for help. I had to provide care while protecting dignity. I offered reassurance, used a private space, involved them in each step of the care, and ensured they had as much independence as possible. The patient's dignity was preserved, and they later said they felt respected and comfortable. This is an amazing 10th question for a patient-centered care Band 5 interview question. I'm going to do 2 more questions for this video. The 11th question that we'll be looking at is, how would you involve patients in shared decision making, especially when they disagree with the clinical advice? How you would tackle this? A patient disagreed with the doctor's recommendation to start a new medication. I needed to support their rights to be involved in decisions while ensuring safety. I listened to their concern, explained the risk and benefits in simple terms, and encouraged them to discuss openly with the doctor. I reassured them that their views would be taken seriously, and the patient agreed to try the medication on a trial basis, feeling their autonomy was respected. This is amazing for you to be able to show how you involve the patient in their decision making, even though they disagreed with the clinical advice. So bringing them back in to being able to take charge and make decisions by themselves. The final question we'll be looking at in this video is, give an example of a time you adapted your approach to meet an individual's patient's need. So a sample answer to this is, a patient with autism struggled with noisy group session. I had to find a way to support and engage them. I spoke with them to understand their triggers and offered quieter one-to-one activity and liaised with the OT to adapt the sessions. The patient became more engaged in care and their distress reduced. So that's the final question we'll be looking at in this video. So those are some of the examples how I would deliver patient-centered care in every situation. My focus is mostly on dignity, respect, on shared decision-making, and empowering patients in their recovery. Thank you so much for watching, and I hope to see you in my next live session. Bye. Hi everyone. Today in this live, you'll be hearing questions and answers for a Band 5 interview in the NHS. This is specifically centered on a mental health nurse questions and answer based on an interview where I sat on the panel. I have the questions on my laptop and the answers where I'll be going through each question and answer for you to be able to understand how best to answer those questions. This live recording will be put on my live stream where you can watch it to be able to go back to it and refer to it based on questions and answers that have been asked. So if you want to watch and want to learn in terms of questions and answers that will be asked for Band 5, please come on and watch this video. I'll be reading from my laptop because this is a different kind of recording, so I can get all the facts and figures for you to be able to know how best to answer those questions. So we'll be looking at it in terms of how best to answer questions. Just a quick introduction. My name is Temi. I'm an HR professional with over 20 years experience working in HR, and I have over 10 years experience working in the NHS. I've had roles from recruitment to employee relations to generalist HR. So I know one thing or two about trying to get a job in the NHS. In this video, we'll be using the STAR method to answer those questions for a Band 5 mental health nurse. So this is the first question that will be asked. What does patient-centered care mean to you? The answer to this question is, to me, patient-centered care means putting the individual at the heart of everything we do. It is about respecting the values, preferences, and choices, and making sure they are fully involved in decisions about their care. In mental health, this means working collaboratively with patients and their family, empowering them in their recovery while also keeping safety and dignity central to the practice. That is a very good way to answer what does patient-centered care mean to you. So you're aware, I'll be reading the answers to these questions from my laptop. So it's not me directly looking at the video, it's just me reading it for you because these are prepared answers that I've prepared for you to be able to get the essence of how best to answer questions and what the interview panel really wants to hear. The second question that would in most cases be asked for a Band 5 mental health nurse is, can you give an example of delivering patient-centered care in practice? The answer to this question using the STAR method is, while working as a healthcare assistant on an acute ward, I supported a patient who was very anxious about attending ward rounds. My task was to help them feel able to have their voice heard. I spent time beforehand listening to their concern, reassured them about the process, and asked them what they wanted the team to know. I offered to sit with them during the meeting and encourage them to speak when they felt ready. As a result, the patient contributed to their care plan, felt listened to, and became more confident in engaging with the team. Another good example that is centered around patient care. Third question that is centered around dignity and respect and also patient-centered care is, tell us about a time you respected a patient's dignity and privacy. The answer to this question is, on one occasion, a patient became very upset when staff started discussing their care in front of others. I recognized that this compromised their dignity. I calmly moved the conversation into a private area, reassured the patient, and reminded colleagues about confidentiality. The patient felt respected, and the team reflected on how important it is to maintain dignity in all situations. That's a very good answer. You might feel as if these answers are short, but they just need you to go straight to the point. So sometimes we don't want to hear long stories because sometimes these interviews we really book them for about 30 minutes. So we're just trying to ensure that we get the essence of how best you will interact with the patient during this situation. The fourth question asked during an interview for a Band 5 mental health nurse is, how have you balanced safety and respecting a patient's autonomy? While on placement, a patient questioned on escorted leave. While on placement, a patient requested unescorted leave, but their risk assessment showed concerns about self-harm. My role was to balance safety and independence. I explained the reasons for temporary restrictions and worked with them to agree a gradual plan, starting with a supervised leave. This meant their safety was maintained, but also they felt included in the decision-making, which built trust between myself and the patients. This was straight to the point, removing all the fluff from there and giving you an idea of how best to answer this kind of question. The fifth question asked during an interview for a Band 5 is, describe the time you advocated for a patient's wishes. So the answer to this question is, a patient once told me they were experiencing unpleasant side effects from their medication, but they felt they weren't being taken seriously. I listened, validated their experience, and documented their concerns. I raised this at handover and encouraged them to share this directly with the doctor, offering to be present in the room if they wished. As a result of this, their medication was reviewed and adjusted. The patient felt more involved and respected in the treatment. A sixth question asked is, how would you involve families and carers in patient-centered care? So the answer to this question in most cases is, or a sample answer I would say to this kind of question is, I would involve families and carers with patients' consents as they can provide valuable insight into the person's history and needs. For example, during discharge planning, I would ensure carers are included in discussions so they can support the patients at home, while keeping the patient's preferences central to the process. So this is a very good one of ensuring that the patients and carers are involved in the patient's care, and it's also a patient-centered care kind of question. The seventh question is, Give an example of supporting a patient's recovery journey. So the sample answer to this question is, while supporting a patient with depression, I noticed they struggle to engage in group activities. I wanted to encourage them without causing pressure. I built rapport fast and asked them about their interest. I suggested starting with short talks as an alternative. Gradually, I encouraged them to attend a group session. Over time, their confidence grew and they began engaging more regularly, which supported their recovery. The eighth question for a Band 5 on patient-centered care is, how would you ensure care remains patient-centered during a busy and stressful shift? How you would answer this question is, on a shift when the ward was short-staffed, several patients needed support at the same time. My task was to ensure patients felt cared for, not just processed. I communicated clearly with patients, explained any delays, and prioritized accordingly to need. I made sure even brief interactions included compassion and reassurance, and I updated patients regularly. Patients felt acknowledged and supported, and the ward remained calm despite the pressure. This is another good example of patient-centered care. The ninth question that would mostly come up for a patient-centered care question for a Band 5 mental health nurse is, can you tell us how you apply the principle of the NMC code in promoting patient-centered care? So the sample answer for this question is, during placement, I worked with a patient who was anxious about medication changes. My role was to uphold the code by prioritizing people, practicing effectively, and preserving safety. I listened to the concern, provided clear explanations, and ensured the nurse in charge was aware. I maintained accurate documentation and ensured the patient's preferences were considered. The result was the patient reported feeling more confident in the decision, and care was both safe and person-centered. That is an amazing answer for you to be able to say during your interview. A 10th question is, what does dignity and respect look like in a day-to-day nursing practice? So a good answer on STAR principle is, I supported a patient who needed assistance with personal care but felt embarrassed asking for help. I had to provide care while protecting dignity. I offered reassurance, used a private space, involved them in each step of the care, and ensured they had as much independence as possible. The patient's dignity was preserved, and they later said they felt respected and comfortable. This is an amazing 10th question for a patient-centered care Band 5 interview question. I'm going to do 2 more questions for this video. The 11th question that we'll be looking at is, how would you involve patients in shared decision making, especially when they disagree with the clinical advice? How you would tackle this? A patient disagreed with the doctor's recommendation to start a new medication. I needed to support their rights to be involved in decisions while ensuring safety. I listened to their concern, explained the risk and benefits in simple terms, and encouraged them to discuss openly with the doctor. I reassured them that their views would be taken seriously, and the patient agreed to try the medication on a trial basis, feeling their autonomy was respected. This is amazing for you to be able to show how you involve the patient in their decision making, even though they disagreed with the clinical advice. So bringing them back in to being able to take charge and make decisions by themselves. The final question we look at you is, give an example of a time you adapted your approach to meet an individual's patient's need. So a sample answer to this is, a patient with autism struggled with noisy group session. I had to find a way to support and engage them. I spoke with them to understand their triggers and offered quieter one-to-one activity and liaised with the OT to adapt the sessions. The patient became more engaged in care and their distress reduced. So that's the final question we'll be looking at in this video. So those are some of the examples how I would deliver patient-centered care in every situation. My focus is mostly on dignity, respect, on shared decision-making, and empowering patients in their recovery. Thank you so much for watching, and I hope to see you in my next live session. Bye. Hi everyone. Today in this live, you'll be hearing questions and answers for a Band 5 interview in the NHS. This is specifically centered on a mental health nurse questions and answer based on an interview where I sat on the panel. I have the questions on my laptop and the answers where I'll be going through each question and answer for you to be able to understand how best to answer those questions. This live recording will be put on my live stream where you can watch it to be able to go back to it and refer to it based on questions and answers that have been asked. So if you want to watch and want to learn in terms of questions and answers that will be asked for Band 5, please come on and watch this video. I'll be reading from my laptop because this is a different kind of recording, so I can get all the facts and figures for you to be able to know how best to answer those questions. So we'll be looking at it in terms of how best to answer questions. Just a quick introduction. My name is Temi. I'm an HR professional with over 20 years experience working in HR, and I have over 10 years experience working in the NHS. I've had roles from recruitment to employee relations to generalist HR. So I know one thing or two about trying to get a job in the NHS. In this video, we'll be using the STAR method to answer those questions for a Band 5 mental health nurse. So what is the first question that will be asked? What does patient-centered care mean to you? The answer to this question is, to me, patient-centered care means putting the individual at the heart of everything we do. It is about respecting the values, preferences, and choices, and making sure they are fully involved in decisions about their care. In mental health, this means working collaboratively with patients and their family, empowering them in their recovery while also keeping safety and dignity central to the practice. That is a very good way to answer what does patient-centered care mean to you. So you're aware, I'll be reading the answers to these questions from my laptop. So it's not me directly looking at the video, it's just me reading it for you because these are prepared answers that I've prepared for you to be able to get the essence of how best to answer questions and what the interview panel really wants to hear. The second question that would in most cases be asked for a Band 5 mental health nurse is, can you give an example of delivering patient-centered care in practice? The answer to this question using the STAR method is, while working as a healthcare assistant on an acute ward, I supported a patient who was very anxious about attending ward rounds. My task was to help them feel able to have their voice heard. I spent time beforehand listening to their concern, reassured them about the process, and asked them what they wanted the team to know. I offered to sit with them during the meeting and encouraged them to speak when they felt ready. As a result, the patient contributed to their care plan, felt listened to, and became more confident in engaging with the team. Another good example that is centered around patient care. Third question that is centered around dignity and respect and also patient-centered care is, tell us about the patient's dignity and privacy. The answer to this question is, on one occasion, a patient became very upset when staff started discussing their care in front of others. I recognized that this compromised their dignity. I calmly moved the conversation into a private area, reassured the patient, and reminded colleagues about confidentiality. The patient felt respected, and the team reflected on how important it is to maintain dignity in all situations. That's a very good answer. You might feel as if these answers are short, but they just need you to go straight to the point. So sometimes we don't want to hear long stories because sometimes these interviews we really book them for about 30 minutes. So we're just trying to ensure that we get the essence of how best you will interact with the patient during this situation. The fourth question asked during an interview for a Band 5 mental health nurse is, how have you balanced safety and respecting a patient's autonomy? While on placement, a patient questioned on escorted leave. While on placement, a patient requested unescorted leave, but their risk assessment showed concerns about self-harm. My role was to balance safety and independence, I explained the reasons for temporary restrictions and worked with them to agree a gradual plan, starting with a supervised leave. This meant their safety was maintained, but also they felt included in the decision making, which built trust between myself and the patients. This was straight to the point, removing all the fluff from there and giving you an idea of how best to answer this kind of question. The fifth question asked during an interview for a Band 5 is, describe the time you advocated for a patient's wishes. So the answer to this question is, a patient once told me they were experiencing unpleasant side effects from their medication, but they felt they weren't being taken seriously. I listened, validated their experience, and documented their concerns. I raised this at handover and encouraged them to share this directly with the doctor, offering to be present in the room if they wished. As a result of this, their medication was reviewed and adjusted. The patient felt more involved and respected in the treatment. A sixth question asked is, how would you involve families and carers in patient-centered care? So the answer to this question in most cases is, or a sample answer I would say to this kind of question is, I would involve families and carers with patients' consents, as they can provide valuable insight into the person's history and needs. For example, during discharge planning, I would ensure carers are included in discussions so they can support the patients at home, while keeping the patient's preferences central to the process. So this is a very good one of ensuring that the patients and carers are involved in the patient's care, and it's also a patient-centered care kind of question. The seventh question is, give an example of supporting a patient's recovery journey. So the sample answer to this question is, while supporting a patient with depression, I noticed they struggle to engage in group activities. I wanted to encourage them without causing pressure. I built rapport fast and asked them about their interest. I suggested starting with short talks as an alternative. Gradually, I encouraged them to attend a group session. Over time, their confidence grew and they began engaging more regularly, which supported their recovery. The eighth question for a Band 5 on patient-centered care is, how would you ensure care remains patient-centered during a busy and stressful shift? How you would answer this question is, on a shift when the ward was short-staffed, several patients needed support at the same time. My task was to ensure patients felt cared for, not just processed. I communicated clearly with patients, explained any delays, and prioritized accordingly to need. I made sure even brief interactions included compassion and reassurance, and I updated patients regularly. Patients felt acknowledged and supported, and the ward remained calm despite the pressure. This is another good example of patient-centered care. The ninth question that would mostly come up for a patient-centered care question for a Band 5 mental health nurse is, can you tell us how you apply the principle of the NMC code in promoting patient-centered care? So the sample answer for this question is, during placement, I worked with a patient who was anxious about medication changes. My role was to uphold the code by prioritizing people, practicing effectively, and preserving safety. I listened to the concern, provided clear explanations, and ensured the nurse in charge was aware. I maintained accurate documentation and ensured the patient's preferences were considered. The result was the patient reported feeling more confident in the decision, and care was both safe and person-centered. That's an amazing answer for you to be able to say during your interview. A 10th question is, what does dignity and respect look like in a day-to-day nursing practice? So a good answer on STAR principle is, I supported a patient who needed assistance with personal care but felt embarrassed asking for help. I had to provide care while protecting dignity. I offered reassurance, used a private space, involved them in each step of the care, and ensured they had as much independence as possible. The patient's dignity was preserved, and they later said they felt respected and comfortable. This is an amazing 10th question for a patient-centered care Band 5 interview question. I'm going to do 2 more questions for this video. The 11th question that we'll be looking at is, how would you involve patients in shared decision making, especially when they disagree with the clinical advice? How you would tackle this? A patient disagreed with the doctor's recommendation to start a new medication. I needed to support their rights to be involved in decisions while ensuring safety. I listened to their concern, explained the risk and benefits in simple terms, and encouraged them to discuss openly with the doctor. I reassured them that their views would be taken seriously, and the patient agreed to try the medication on a trial basis, feeling their autonomy was respected. This is amazing, for you to be able to show how you involve the patient in their decision making, even though they disagreed with the clinical advice. So bringing them back in to being able to take charge and make decisions by themselves. The final question we'll be looking at in this video is, give an example of a time you adapted your approach to meet an individual's patient's need. So a sample answer to this is, a patient with autism struggled with noisy group session. I had to find a way to support and engage them. I spoke with them to understand their triggers and offered quieter one-to-one activity and liaised with the OT to adapt the sessions. The patient became more engaged in care and their distress reduced. So that's the final question we'll be looking at in this video. So those are some of the examples of how I would deliver patient-centered care in every situation. My focus is mostly on dignity, respect, on shared decision making, and empowering patients in their recovery. Thank you so much for watching, and I hope to see you in my next live session. Bye. Hi everyone. Today in this live, you'll be hearing questions and answers for a Band 5 interview in the NHS. This is specifically centered on a mental health nurse questions and answer based on an interview where I sat on the panel. I have the questions on my laptop and the answers where I'll be going through each question and answer for you to be able to understand how best to answer those questions. This live recording or this recording will be put on my live stream where you can watch it to be able to go back to it and refer to it based on questions and answers that have been asked. So if you want to watch and want to learn in terms of questions and answers that will be asked for a Band 5, please come on and watch this video. I'll be reading from my laptop because this is a different kind of recording, so I can get all the facts and figures for you to be able to know how best to answer those questions. So we'll be looking at it in terms of how best to answer questions. Just a quick introduction. My name is Temi. I'm an HR professional with over 20 years experience working in HR, and I have over 10 years experience working in the NHS. I've had roles from recruitment to employee relations to generalist HR. So I know one thing or two about trying to get a job in the NHS. In this video, we'll be using the STAR method to answer those questions for a Band 5 mental health nurse. So what is the first question that will be asked? What does patient-centered care mean to you? The answer to this question is, to me, patient-centered care means putting the individual at the heart of everything we do. It is about respecting the values, preferences, and choices, and making sure they are fully involved in decisions about their care. In mental health, this means working collaboratively with patients and their family, empowering them in their recovery while also keeping safety and dignity central to the practice. That is a very good way to answer what does patient-centered care mean to you. So you're aware, I'll be reading the answers to these questions from my laptop. So it's not me directly looking at the video, it's just me reading it for you because these are prepared answers that I've prepared for you to be able to get the essence of how best to answer questions and what the interview panel really wants to hear. The second question that would in most cases be asked for a Band 5 mental health nurse is, can you give an example of delivering patient-centered care in practice? The answer to this question using the STAR method is, while working as a healthcare assistant on an acute ward, I supported a patient who was very anxious about attending ward rounds. My task was to help them feel able to have their voice heard. I spent time beforehand listening to their concern, reassured them about the process, and asked them what they wanted the team to know. I offered to sit with them during the meeting and encouraged them to speak when they felt ready. As a result, the patient contributed to their care plan, felt listened to, and became more confident in engaging with the team. Another good example that is centered around patient care. Third question that is centered around dignity and respect, and also patient-centered care, is tell us about a time you respected a patient's dignity and privacy. The answer to this question is on one occasion, a patient became very upset when staff started discussing their care in front of others. I recognized that this compromised their dignity. I calmly moved the conversation into a private area, reassured the patient, and reminded colleagues about confidentiality. The patient felt respected, and the team reflected on how important it is to maintain dignity in all situations. That's a very good answer. You might feel as if these answers are short, but they just need you to go straight to the point. So sometimes we don't want to hear long stories, because sometimes these interviews we really book them for about 30 minutes. So we're just trying to ensure that we get the essence of how best you will interact with the patient during the situation. The fourth question asked during an interview for a Band 5 mental health nurse is, how have you balanced safety and respecting a patient's autonomy? While on placement, a patient questioned on escorted leave. While on placement, a patient requested unescorted leave, but their risk assessment showed concerns about self-harm. My role was to balance safety and independence. I explained the reasons for temporary restrictions and worked with them to agree a gradual plan, starting with a supervised leave. This meant their safety was maintained, but also they felt included in the decision-making, which built trust between myself and the patients. This was straight to the point, removing all the fluff from there and giving you an idea of how best to answer this kind of question. The fifth question asked during an interview for a Band 5 is, describe the time you advocated for a patient's wishes. So the answer to this question is, a patient once told me they were experiencing unpleasant side effects from their medication, but they felt they weren't being taken seriously. I listened, validated their experience, and documented their concerns. I raised this at handover and encouraged them to share this directly with the doctor, offering to be present in the room if they wished. As a result of this, their medication was reviewed and adjusted. The patient felt more involved and respected in the treatment. A sixth question asked is, how would you involve families and carers in patient-centered care? So the answer to this question in most cases is, or a sample answer that would say to this kind of question is, I would involve families and carers with patients' consents, as they can provide valuable insight into the person's history and needs. For example, during discharge planning, I would ensure carers are included in discussions so they can support the patients at home, while keeping the patient's preferences central to the process. So this is a very good one of ensuring that the patients and carers are involved in the patient's care, and it's also a patient-centered care kind of question. The seventh question is, give an example of supporting a patient's recovery journey. So the sample answer to this question is, while supporting a patient with depression, I noticed the struggle to age in group activities. I wanted to encourage them without causing pressure. I built rapport fast and asked them about their interest. I suggested starting with short talks as an alternative. Gradually, I encouraged them to attend a group session. Over time, their confidence grew and they began engaging more regularly, which supported their recovery. The eighth question for a Band 5 on patient-centered care is, how would you ensure care remains patient-centered during a busy and stressful shift? How you would answer this question is, on a shift when the ward was short-staffed, several patients needed support at the same time. My task was to ensure patients felt cared for, not just processed. I communicated clearly with patients, explained any delays, and prioritized accordingly to need. I made sure even brief interactions included compassion and reassurance, and I updated patients regularly. Patients felt acknowledged and supported, and the ward remained calm despite the pressure. This is another good example of patient-centered care. The ninth question that would mostly come up for a patient-centered care question for a Band 5 mental health nurse is, can you tell us how you apply the principle of the NMC code in promoting patient-centered care? So the sample answer for this question is, during placement, I worked with a patient who was anxious about medication changes. My role was to uphold the code by prioritizing people, practicing effectively, and preserving safety. I listened to the concern, provided clear explanations, and ensured the nurse in charge was aware. I maintained accurate documentation and ensured the patient's preferences were considered. The result was the patient reported feeling more confident in the decision, and care was both safe and person-centered. That is an amazing answer for you to be able to say during your interview. A 10th question is, what does dignity and respect look like in a day-to-day nursing practice? So a good answer on STAR principle is, I supported a patient who needed assistance with personal care but felt embarrassed asking for help. I had to provide care while protecting dignity. I offered reassurance, used a private space, involved them in each step of the care, and ensured they had as much independence as possible. The patient's dignity was preserved, and they later said they felt respected and comfortable. This is an amazing 10th question for a patient-centered care Band 5 interview question. I'm going to do 2 more questions for this video. The 11th question that we'll be looking at is, how would you involve patients in shared decision making, especially when they disagree with the clinical advice? How you would tackle this? A patient disagreed with the doctor's recommendation to start a new medication. I needed to support their rights to be involved in decisions while ensuring safety. I listened to their concern, explained the risk and benefits in simple terms, and encouraged them to discuss openly with the doctor. I reassured them that their views would be taken seriously, and the patient agreed to try the medication on a trial basis, feeling their autonomy was respected. This is amazing for you to be able to show how you involve the patient in their decision making, even though they disagreed with the clinical advice. So bringing them back in to being able to take charge and make decisions by themselves. The final question we'll be looking at in this video is, give an example of a time you adapted your approach to meet an individual's patient's need. So a sample answer to this is, a patient with autism struggled with noisy group session. I had to find a way to support and engage them. I spoke with them to understand their triggers and offered quieter one-to-one activity and liaised with the OT to adapt the sessions. The patient became more engaged in care and their distress reduced. So that's the final question we'll be looking at in this video. So those are some of the examples how I would deliver patient-centered care in every situation. My focus is mostly on dignity, respect, on shared decision-making, and empowering patients in their recovery. Thank you so much for watching, and I hope to see you in my next live session. Bye. Hi everyone. Today in this live, you'll be hearing questions and answers for a Band 5 interview in the NHS. This is specifically centered on a mental health nurse questions and answer based on an interview where I sat on the panel. I have the questions on my laptop and the answers where I'll be going through each question and answer for you to be able to understand how best to answer those questions. This live recording or this recording will be put on my live stream where you can watch it to be able to go back to it and refer to it based on questions and answers that have been asked. So if you want to watch and want to learn in terms of questions and answers that will be asked for Band 5, please come on and watch this video. I'll be reading from my laptop because this this is a different kind of recording, so I can get all the facts and figures for you to be able to know how best to answer those questions. So we'll be looking at it in terms of how best to answer questions. Just a quick introduction. My name is Temi. I'm an HR professional with over 20 years experience working in HR, and I have over 10 years experience working in the NHS. I've had roles from recruitment to employee relations to generalist HR. So I know one thing or two about trying to get a job in the NHS. In this video, we'll be using the STAR method to answer those questions for a Band 5 mental health nurse. So this is the first question that will be asked. What does patient-centered care mean to you? The answer to this question is, to me, patient-centered care means putting the individual at the heart of everything we do. It is about respecting the values, preferences, and choices, and making sure they are fully involved in decisions about their care. In mental health, this means working collaboratively with patients and their family, empowering them in their recovery while also keeping safety and dignity central to the practice. That is a very good way to answer what does patient-centered care mean to you. So you're aware, I'll be reading the answers to these questions from my laptop. So it's not me directly looking at the video, it's just me reading it for you because these are prepared answers that I've prepared for you to be able to get the essence of how best to answer questions and what the interview panel really wants to hear. The second question that would in most cases be asked for a Band 5 mental health nurse is, can you give an example of delivering patient-centered care in practice? The answer to this question using the STAR method is, while working as a healthcare assistant on an acute ward, I supported a patient who was very anxious about attending ward rounds. My task was to help them feel able to have their voice heard. I spent time beforehand listening to their concern, reassured them about the process, and asked them what they wanted the team to know. I offered to sit with them during the meeting and encouraged them to speak when they felt ready. As a result, the patient contributed to their care plan, felt listened to, and became more confident in engaging with the team. Another good example that is centered around patient care. Third question that is centered around dignity and respect and also patient-centered care is, tell us about a time you respected a patient's dignity and privacy. The answer to this question is, on one occasion, a patient became very upset when staff started discussing their care in front of others. I recognized that this compromised their dignity. I calmly moved the conversation into a private area, reassured the patient, and reminded colleagues about confidentiality. The patient felt respected, and the team reflected on how important it is to maintain dignity in all situations. That's a very good answer. You might feel as if these answers are short, but they just need you to go straight to the point. So sometimes we don't want to hear long stories because sometimes these interviews we really book them for about 30 minutes. So we're just trying to ensure that we get the essence of how best you will interact with the patient during the situation. The fourth question asked during an interview for a Band 5 mental health nurse is, how have you balanced safety and respecting a patient's autonomy? While on placement, a patient questioned on escorted leave. While on placement, a patient requested unescorted leave, but their risk assessment showed concerns about self-harm. My role was to balance safety and independence. I explained the reasons for temporary restrictions and worked with them to agree a gradual plan, starting with a supervised leave. This meant their safety was maintained, but also they felt included in the decision-making, which built trust between myself and the patients. This was straight to the point, removing all the fluff from there and giving you an idea of how best to answer this kind of question. The fifth question asked during an interview for a Band 5 is, describe a time you advocated for a patient's wishes. So the answer to this question is, a patient once told me they were experiencing unpleasant side effects from their medication, but they felt they weren't being taken seriously. I listened, validated their experience, and documented their concerns. I raised this at handover and encouraged them to share this directly with the doctor, offering to be present in the room if they wished. As a result of this, their medication was reviewed and adjusted. The patient felt more involved and respected in the treatment. A sixth question asks, is, how would you involve families and carers in patient-centered care? So the answer to this question in most cases is, or a sample answer I would say to this kind of question is, I would involve families and carers with patients' consents, as they can provide valuable insight into the person's history and needs. For example, during discharge planning, I would ensure carers are included in discussions so they can support the patients at home, while keeping the patient's preferences central to the process. So this is a very good one of ensuring that the patients and carers are involved in the patient's care, and it's also a patient-centered care kind of question. The seventh question is, give an example of supporting a patient's recovery journey. So the sample answer to this question is, while supporting a patient with depression, I noticed the struggle to age in group activities. I wanted to encourage them without causing pressure. I built rapport fast and asked them about their interest. I suggested starting with short talks as an alternative. Gradually, I encouraged them to attend a group session. Over time, their confidence grew and they began engaging more regularly, which supported their recovery. The eighth question for a Band 5 on patient-centered care is, how would you ensure care remains patient-centered during a busy and stressful shift? How you would answer this question is, on a shift when the ward was short-staffed, several patients needed support at the same time. My task was to ensure patients felt cared for, not just processed. I communicated clearly with patients, explained any delays, and prioritized accordingly to need. I made sure even brief interactions included compassion and reassurance, and I updated patients regularly. Patients felt acknowledged and supported, and the ward remained calm despite the pressure. This is another good example of patient-centered care. The ninth question that would mostly come up for a patient-centered care question for a Band 5 mental health nurse is, can you tell us how you apply the principle of the NMC code in promoting patient-centered care? So the sample answer for this question is, during placement, I worked with a patient who was anxious about medication changes. My role was to uphold the code by prioritizing people, practicing effectively, and preserving safety. I listened to the concern, provided clear explanations, and ensured the nurse in charge was aware. I maintained accurate documentation and ensured the patient's preferences were considered. The result was the patient reported feeling more confident in the decision, and care was both safe and person-centered. That is an amazing answer for you to be able to say during your interview. A 10th question is, what does dignity and respect look like in a day-to-day nursing practice? So a good answer on STAR principle is, I supported a patient who needed assistance with personal care but felt embarrassed asking for help. I had to provide care while protecting dignity. I offered reassurance, used a private space, involved them in each step of the care, and ensured they had as much independence as possible. The patient's dignity was preserved, and they later said they felt respected and comfortable. This is an amazing 10th question for a patient-centered care Band 5 interview question. I'm going to do 2 more questions for this video. The 11th question that we'll be looking at is, how would you involve patients in shared decision making, especially when they disagree with the clinical advice? How you would tackle this? A patient disagreed with the doctor's recommendation to start a new medication. I needed to support their rights to be involved in decisions while ensuring safety. I listened to their concern, explained the risk and benefits in simple terms, and encouraged them to discuss openly with the doctor. I reassured them that their views would be taken seriously, and the patient agreed to try the medication on a trial basis, feeling their autonomy was respected. This is amazing for you to be able to show how you involve the patient in their decision making, even though they disagreed with the clinical advice. So bringing them back in to being able to take charge and make decisions by themselves. The final question we'll be looking at in this video is, Give an example of a time you adapted your approach to meet an individual's patient's need. So a sample answer to this is, a patient with autism struggled with noisy group session. I had to find a way to support and engage them. I spoke with them to understand their triggers and offered quieter one-to-one activity and liaised with the OT to adapt the sessions. The patient became more engaged in care and their distress reduced. So that's the final question we'll be looking at in this video. So those are some of the examples of how I would deliver patient-centered care in every situation. My focus is mostly on dignity, respect, on shared decision-making, and empowering patients in their recovery. Thank you so much for watching, and I hope to see you in my next live session. Bye. Hi everyone. Today in this live, you'll be hearing questions and answers for a Band 5 interview in the NHS. This is specifically centered on a mental health nurse questions and answer based on an interview where I sat on the panel. I have the questions on my laptop and the answers where I'll be going through each question and answer for you to be able to understand how best to answer those questions. This live recording or this recording will be put on my live stream where you can watch it to be able to go back to it and refer to it based on questions and answers that have been asked. So if you want to watch and want to learn in terms of questions and answers that will be asked for a Band 5, please come on and watch this video. I'll be reading from my laptop because this is a different kind of recording, so I can get all the facts and figures for you to be able to know how best to answer those questions. So we'll be looking at it in terms of how best to answer questions. Just a quick introduction. My name is Temi. I'm an HR professional with over 20 years experience working in HR, and I have over 10 years experience working in the NHS. I've had roles from recruitment to employee relations to generalist HR. So I know one thing or two about trying to get a job in the NHS. In this video, we'll be using the STAR method to answer those questions for a Band 5 mental health nurse. So what is the first question that will be asked? What does patient-centered care mean to you? The answer to this question is, to me, patient-centered care means putting the individual at the heart of everything we do. It is about respecting the values, preferences, and choices, and making sure they are fully involved in decisions about their care. In mental health, this means working collaboratively with patients and their families, empowering them in their recovery while also keeping safety and dignity central to the practice. That is a very good way to answer what does patient-centered care mean to you. So you're aware, I'll be reading the answers to these questions from my laptop. So it's not me directly looking at the video, it's just me reading it for you because these are prepared answers that I've prepared for you to be able to get the essence of how best to answer questions and what the interview panel really wants to hear. The second question that would in most cases be asked for a Band 5 mental health nurse is, can you give an example of delivering patient-centered care in practice? The answer to this question using the STAR method is, while working as a healthcare assistant on an acute ward, I supported a patient who was very anxious about attending ward rounds. My task was to help them feel able to have their voice heard. I spent time beforehand listening to their concern, reassured them about the process, and asked them what they wanted the team to know. I offered to sit with them during the meeting and encourage them to speak when they felt ready. As a result, the patient contributed to their care plan, felt listened to, and became more confident in engaging with the team. Another good example that is centered around patient care. Third question that is centered around dignity and respect and also patient-centered care is, tell us about a time you respected a patient's dignity and privacy. The answer to this question is, on one occasion, a patient became very upset when staff started discussing their care in front of others. I recognized that this compromised their dignity. I calmly moved the conversation into a private area, reassured the patient, and reminded colleagues about confidentiality. The patient felt respected, and the team reflected on how important it is to maintain dignity in all situations. That's a very good answer. You might feel as if these answers are short, but they just need you to go straight to the point. So sometimes we don't want to hear long stories, because sometimes these interviews we really book them for about 30 minutes. So we're just trying to ensure that we get the essence of how best you will interact with the patient during this situation. The fourth question asked during an interview for a Band 5 mental health nurse is, how have you balanced safety and respecting a patient's autonomy? While on placement, a patient questioned on escorted leave. While on placement, a patient requested unescorted leave, but their risk assessment showed concerns about self-harm. My role was to balance safety and independence. I explained the reasons for temporary restrictions and worked with them to agree a gradual plan, starting with a supervised leave. This meant their safety was maintained, but also they felt included in the decision-making, which built trust between myself and the patients. This was straight to the point, removing all the fluff from there and giving you an idea of how best to answer this kind of question. The fifth question asked during an interview for a Band 5 is, describe the time you advocated for a patient's wishes. So the answer to this question is, a patient once told me they were experiencing unpleasant side effects from their medication, but they felt they weren't being taken seriously. I listened, validated their experience, and documented their concerns. I raised this at handover and encouraged them to share this directly with the doctor, offering to be present in the room if they wished. As a result of this, their medication was reviewed and adjusted. The patient felt more involved and respected in the treatment. A sixth question asked is, how would you involve families and carers in patient-centered care? So the answer to this question in most cases is, or a sample answer that would say to this kind of question is, I would involve families and carers with patients' consents, as they can provide valuable insight into the person's history and needs. For example, during discharge planning, I would ensure carers are included in discussions so they can support the patients at home, while keeping the patient's preferences central to the process. So this is a very good one of ensuring that the patients and carers are involved in the patient's care, and is also a patient-centered care kind of question. The seventh question is, give an example of supporting a patient's recovery journey. So the sample answer to this question is, while supporting a patient with depression, I noticed the struggle to engage in group activities. I wanted to encourage them without causing pressure. I built rapport fast and asked them about their interest. I suggested starting with short talks as an alternative. Gradually, I encouraged them to attend a group session. Over time, their confidence grew and they began engaging more regularly, which supported their recovery. The eighth question for a Band 5 on patient-centered care is, how would you ensure care remains patient-centered during a busy and stressful shift? How you would answer this question is, on a shift when the ward was short-staffed, several patients needed support at the same time. My task was to ensure patients felt cared for, not just processed. I communicated clearly with patients, explained any delays, and prioritized accordingly to need. I made sure even brief interactions included compassion and reassurance, and I updated patients regularly. Patients felt acknowledged and supported, and the ward remained calm despite the pressure. This is another good example of patient-centered care. The ninth question that would mostly come out for a patient-centered care question for a Band 5 mental health nurse is, can you tell us how you apply the principle of the NMC code in promoting patient-centered care? So the sample answer for this question is, during placement, I worked with a patient who was anxious about medication changes. My role was to uphold the code by prioritizing people, practicing effectively, and preserving safety. I listened to the concern, provided clear explanations, and ensured the nurse in charge was aware. I maintained accurate documentation and ensured the patient's preferences were considered. The result was the patient reported feeling more confident in the decision, and care was both safe and person-centered. That is an amazing answer for you to be able to say during your interview. A 10th question is, what does dignity and respect look like in a day-to-day nursing practice? So a good answer on STAR principle is, I supported a patient who needed assistance with personal care but felt embarrassed asking for help. I had to provide care while protecting dignity. I offered reassurance, used a private space, involved them in each step of the care, and ensured they had as much independence as possible. The patient's dignity was preserved, and they later said they felt respected and comfortable. This is an amazing 10th question for a patient-centered care Band 5 interview question. I'm going to do 2 more questions for this video. The 11th question that we'll be looking at is, how would you involve patients in shared decision making, especially when they disagree with the clinical advice? How you would tackle this? A patient disagreed with the doctor's recommendation to start a new medication. I needed to support their rights to be involved in decisions while ensuring safety. I listened to their concern, explained the risk and benefits in simple terms, and encouraged them to discuss openly with the doctor. I reassured them that their views would be taken seriously, and the patient agreed to try the medication on a trial basis, feeling their autonomy was respected. This is amazing for you to be able to show how you involve the patient in their decision making, even though they disagreed with the clinical advice. So bringing them back in to being able to take charge and make decisions by themselves. The final question we'll be looking at in this video is, give an example of a time you